A local hospital is making a woman's dreams come true. She was in a childhood accident in her homeland of Costa Rica and has suffered from it her entire life. Now, Foundation Surgical Hospital has brought her here to Houston to help repair what others doctors believe was an irreparable injury.
Keep going, keep going, keep going. Back in. Pull, 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 pull.
Margoth Vega is now undergoing rehab at Foundation Surgical Hospital following an unprecedented surgery there.
I think it is impossible. My leg is better, and now it's better.
Dr. Eric Bertman had traveled to Costa Rica on a medical mission when he found out about Margoth's situation.
Better. This one's better, too.
Yeah.
This is how Margoth walked before surgery. When she was only 3 years old, she was playing in a wheelbarrow with her brothers, but toppled out of it. It was a serious injury that went ignored for weeks until she got a high fever. Doctors realized she had a broken hip with a severe infection in her hip and knee. Multiple surgeries then only aggravated the problem.
As she grew, the hip just simply didn't develop. And so she had, normally the hip is a socket with a ball in it, and she had no socket and no ball. And the femur bone, the thigh bone, was about half the size of a normal thigh bone.
When Dr. Bergman showed Margoth's x-rays to his colleague, orthopedic surgeon Dr. Terry Clyburn, even he was doubtful she could be helped.
And honestly, when I first looked at the x-rays, I wasn't sure whether it could be fixed or not either. But we decided that we would bring her to Houston if we could and do what's called a three-dimensional CAT scan.
That technology helped them determine with the right skills and equipment they could perform surgery. Foundation Surgical Hospital agreed to let them do the surgery for free. And implant provider Zimmer offered the specialized equipment at no cost.
We brought her in, we brought the equipment in, we said a prayer, crossed our fingers, and launched into this thing, and fortunately so far it's gone very well. We put the new socket here into the socket that we created, and we fixed that socket to the bone with 2 screws as well. This is the stem, and this stem is made specifically for patients with extremely small bone.
Margoth says disabilities aren't well accepted in Costa Rica, so she ended up dropping out of school in the 6th grade to escape the ridicule.
You doing okay?
Yeah, okay.
We got about 2 or 3 more here.
She went on to get married and successfully manages a restaurant in Costa Rica with her husband. Against her doctor's advice, she even got pregnant and had a healthy baby boy.
She worked full 12, 16-hour days, children, the whole works. And the people that know her there say that she has a smile 24/7 and doesn't consider herself any disability. She just felt that she had a limp and a very short leg.
Her conditioning has been worsening, though, and doctors warned she would soon be permanently restricted to a wheelchair. But her fate changed forever through the caring and skillful hands of doctors in Houston.
That's what I'm here for. I mean, that's what you train for 14 years as a physician, to get that feeling all the time. The more we can do it, the better off we are.
My family is so happy. I call my family, and my mom is crying. My sister is crying. For what's crying? No crying. I'm okay. I'm so happy. This is my hero. And the other doctor. This is my hero. All the time is cold. Yeah, all the time. Yeah. Yeah. Thank you, doctor. Thank you so much.
Thank you.
I love you.
Margoth has to undergo rehab for a month here. Then she hopes to come back in 6 months for more surgery, next time to her knee.